Hello everyone, I am Dr. Revati, lecturer from the Department of Obstetrics and Gynecology, Faculty of Physiotherapy, Dr.M.G.R. Educational and Research Institute. Today we are going to see about the perineometer. So perineometer is a device which is used to assess the pelvic floor muscle strength and also the endurance. It is an assessment tool which is used for the assessment of your pelvic floor muscles. So it can be used in a way in which we can apply the condom over the perineometer, and we can apply some lubricant gel and insert it into the vagina of the women. So we ask the patient to contract the vaginal muscles, thereby it can be seen through the analog meter. So when pressure increases, the analog shows the deflection in the analog meter, so that the pressure can be seen through your perineometer. So it is a tool where we have three sizes. So the larger one can be used for a very lax muscles, and the middle one and also the smaller one can be used as a biofeedback. So it helps in doing the Kegels exercise also. Perineometer is a device which can be used to assess different conditions like pelvic floor dysfunction, urinary incontinence, fecal incontinence, and also the pelvic organ prolapse. So it can be used to assess the weakness of your pelvic floor muscles. Thereby it can be used as a tool to do the Kegels exercise, also strengthen your pelvic floor muscles. This device can be used for different study purposes to assess the pelvic floor muscle strength and endurance. Thank you. Now we are going to see about the vaginal cones. So vaginal cones is a device which can be used for strengthen the pelvic floor muscles. So we have two sizes of your vaginal cones are there. So one is the smaller one and the larger one. So always when the muscle is very lax, we can use a larger size of the vaginal cones. So we have different weights here. So 5 grams, 10 grams, 20 grams and 50 grams of your weights. So we can put the weights over the vaginal cones and apply a condom over it, and we can apply some lubricant gel and insert it into the vagina. So we ask the patient to contract the vaginal cone and hold it. So the patient is asked to walk with the vaginal cones without using any panty, and they should not contract the thigh muscles, the gluteal muscles and also the abdominal muscles while holding the vaginal cones, so that the biofeedback can be given to the pelvic floor muscles. They can contract only the PFM muscles during the weights. So we can increase the weights to increase the progression of the muscles strength, and it can be inserted into the vagina. Again the same process can be done. So vaginal cones can be used for urinary incontinence, fecal incontinence, pelvic organ prolapse and pelvic floor dysfunctions. So it should not be used for the women who are not sexually active. So we ask the patient to hold the vaginal cones by contracting the pelvic floor muscles, and it can be removed through the tail which is there in the vaginal cones. So it can be used for urinary incontinence, fecal incontinence, pelvic organ prolapse, pelvic floor dysfunctions, and it cannot be used for the persons who have active infections, allergies, those who have menstrual disorders. Vaginal cones can be used for urinary incontinence, fecal incontinence, pelvic floor dysfunction, pelvic organ prolapse. It should not be used for unmarried women, those who have active infection, urinary tract infection, menstrual disorders and active allergies or infections. Thank you.